common problem is that people get the B12 and the folate misinterpreted a lot on their blood work, right? And it's because we do have a blood test assessment for B12 and folate, but that's not really the nutritional status of B12 and folate. And this article that I wrote kind of goes into that. What we don't want to have happen is for you to mistakenly get told to stop taking B12 and folate when in fact you should stay on it. You know, first thing first is you do have to be off your B vitamins before you go in for testing, right? The B vitamin actually, like, even though it's water soluble, the dose spikes between 5 and 7 days after you have taken B vitamins. So they're in your system for a little bit. So if you're truly to get a baseline, you would want to have 5 to 7 days off that B vitamin. You can kind of cut that time frame shorter if the dose is smaller. If it's between less than 1 or 2 milligrams, then you can get away with 3 to 4 days. But if you just had like a B vitamin IV or a B12 injection, you're going to want to wait at least 5 to 7 days before getting that test done, because it'll be kind of abnormally high. It's not going to reflect the body's steady state. It will reflect the spike in the last dose that you took. Does that make sense? That's usually my first question to somebody. If the B vitamins came back positive or really, really, I ask them, when was the last time you took the dose of this? And even when I'm suggesting for these tests to be ordered, I make sure people know to be off within 3 to 4 days or 5 to 7 days, depending on how much they're taking.